are costing from 2 lakhs to 50, 60, 70, 80 lakhs. The machine which should ideally be used should have a basic research and development and a safety profile which is the machine is passing, because there are n number of companies who are promoting n number of lasers. Like for me, people are coming and telling, madam ye laser le lo, aap paise baad mein de dena. But you teach, and it is all a fishy market right now. So consider the safety of the machine before you buy any machine. R&D machine ka dekho kya hua hai, how much is the research that has been done on the machine, how much is the safety profile of the machine, and then invest into it, because otherwise we are going to harm and we are going to create holes into bladder and rectum directly.
Oh, 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 oh. And as far as the lasers are concerned, which one do you advise? 360-degree laser is okay, or the 90-degree which you have to keep on rotating?
So it depends upon person to person. It depends upon the technicalities. 360 laser is very convenient to use. It is like driving a Mercedes. 90 degrees is like driving an Maruti 800. It's like that.
So cost is also like Mercedes and Maruti.
Yes. Cost is also like that.
Okay, okay, that was a fantastic talk. And again, when we go in for the lasers,
Mm.
any Indian lasers which are up to the which have got the safety standards?
So I don't know any of the Indian companies which have got the good safety standards. What I have studied for buying my machine, the best which I found was Photona Smooth, which was costing 1.2 CR 2 years back.
Wow.
Then second was Mona Lisa Touch, that was costing around 75 lakhs that time. So I dropped on the idea of buying a laser. I went ahead with InMode Impar radio frequency machine, which is costing me 40 lakhs for the vaginal probes. So that is what I have invested into my practice.
That's a bomb. Anyway, even 40 lakhs is huge. Acha, are these lasers available on rent? RENT rent?
So the rental lasers which are available, they are quality-wise very poor, very poor. It is not at all advisable to use them, because the laser machine ideally should not be transported. Because it has so delicate fibers inside it, so transportation breaks the fibers into micro fragments. So it hampers the quality and safety of the machine. So lasers on rent should be avoidable. As far as it is possible, don't use it for vagina.
Okay, okay. Any other questions? I don't think there would be any other questions. I think Dr. Rachna, there appears to be some issue. Yeah. Thank you, Dr. Renuka, and we look
Yeah.
forward
Thank you, sir.
to hear from you also.
Yeah.
Yeah, thank you. And Dr. Rachna, I think you, without much ado, I think you, as far as the slides are moving, it's fine. Need not go on the slideshow mode.
Okay, sir.
Just increase the magnification on your lower right. Right now it is 96% magnified.
Yes, sir.
If it is, हाँ, तो आप बस बहुत नहीं ये
हाँ.
बस ये बहुत हो गया.
ठीक है सर.
कोई प्रॉब्लम नहीं, चकाचक है, एकदम मस्त दिख
Can
रहा
I
है,
begin? Okay, okay.
एकदम मस्त
Thank
दिख रहा
you.
है. अच्छा, और डॉक्टर कुमार ने बोला आपको भी देखना है, आप भी दिख रहे हो, सब बढ़िया है, कोई
Yes.
प्रॉब्लम नहीं
So
है.
I am going to start directly. Thank you for being patient. So my topic for today is HIFU, innovative technology and her. We've already discussed about quality of life. I want to talk about this slide. So when I made my slide for the first time, this is the very first talk that I ever gave on cosmetic gynecology, and I have in bold written that this is cosmetic gynec is not a medical requirement, and this slide today stands corrected because we all know that functional gynecology can be treated very very well with a lot of modalities that we use in cosmetics. So as a young budding gynecologist, I was under an impression, and I did my fellowship in UAE, so it was all about the glamour and the aesthetics part of it, but I definitely did not know how much of functionality we are going to be treating and how much of functionality we are actually going to be addressing. So this is what I want to talk about on this slide. Now basically let's talk about what are the issues that women are facing, because we all as gynecologists know there are going to be a lot of physiological changes in entire span of a woman's reproductive life. Childbirth, menopause, aging are all extremely important milestone in a woman's life, and that brings about a lot of hormonal changes and changes in her body, temperament, and so many other things. So these changes need to be addressed. Now, when we are talking about gynecological concerns, we are dealing with we divide them into two sections. One are typically reproductive age group women and postpartum women. They come with issues of vaginal laxity, SUI, changes in appearance, and even recurrent vaginal infections. Some are bold enough to accept that they have not got orgasms, and there's the different and changes that they have noticed in their sexual function. Now, middle age or menopausal typically come with symptoms of GSM. I think GSM is one of the most helped by this branch. So, if there's one patient that I would choose to treat with cosmetic gynec procedures, it would be someone who is between the age of 40 to 48, 49 ish or so. The other issues that these age group patients come with is SUI, introital widening, which also along with prolapse, dyspareunia, urinary complaints like frequency, urgency, recurrent infections, and of course, wrinkling in the perineal region. Now we are going to be speaking about three important symptoms that women of this age group will be requiring. One is GSM. As we know that in 2014, urogenital atrophy has been now renamed as GSM, and rightly so. There are multiple signs and symptoms that we already know. Patients come with dryness, lack of lubrication, discomfort, pain, postcoital bleeding. When we examine, we see that there's decreased elasticity, moisture, there is loss of tone, the vagina seems extremely friable and pale. So these are all symptoms that we are dealing with, and then we know that we are dealing with a patient with GSM. Now, female sexuality, as Dr. Renuka rightly said, is a very, very undiscussed, closed door conversations. Even today, women, even today, female gynecologists don't come up with this history, but you need to dig into the information. And a lot of women will have these problems. They have difficulty in lubrication, pain during intercourse, a full-blown vaginismus, sometimes difficulty in arousal, orgasms, or a overall dissatisfaction that they mention that they have during sexual activity. Now, there was a term called vaginal relaxation syndrome, though we do not use that anymore. But in terms of my talk, it's a little relevant, so I included this in my talk. So basically, what that means is the defects that we see in the vaginal wall, which we do as gynecologists, we do correct it with surgery. But what they are saying is that 8 out of 10 women who have had at least one normal delivery will have this vaginal relaxation syndrome. This vaginal relaxation syndrome will reduce the friction that is there in the during the intercourse, and which eventually will lead to lesser sexual gratification, which is why we need to correct it either through non-invasive procedures, or if she has symptoms, then through surgery as well. Now, there are a lot of modalities that we use in cosmetic gynecology, which we are going to be discussing over the course of this entire thing. I think as people who are trying to see these courses, you are trying to figure out where cosmetic gynec fits into your practice, what machines to buy. I've seen a couple of questions, and mostly the questions about which machine to buy. Now, any gynecologist who's been doing cosmetic gynecologist for some time will say that there's no right machine to buy, or there's no one absolute machine that you require. But there is based on how your patient is, where you're practicing, what sort of questions your patient asks, you can decide what you can use or what you can implement in your patients. Now, I started with HIFU, frankly, because it was the cheapest thing available. And I'm here to tell you, as a cosmetic gynecologist who's practicing in Powai, that if you are doing PRP and you are doing HIFU, then you are solving a lot of problems of patients. And there was also initially a lot of hesitation about HIFU because there's no studies. In fact, now in my presentation, I will be discussing how there's only one or two actual papers about HIFU. But I think what we can do as a community of gynecologists is we can change that. We can do these, we can use HIFU in a slightly guarded manner. We can, collect all the data and publish our data, because we are a big clan of people, and we can definitely do that and see, because according to me, HIFU works very well for tightening. Yes, when there is lack of lubrication, when there is a little bit of discomfort, vaginal infections, laser radiofrequency work very well. But when we want actual tightening, when we see that there is introital laxity, then a lot of machines cannot penetrate to the actual depth wherein we want that the heat to come in. So HIFU in that case theoretically is a very good option, and in my practice I've seen that patients do come back and give me a feedback that it really worked well for them. So it's only a matter of time that studies will come in. So let's jump into HIFU, because I think it really deserves a mention in cosmetic gynec practice. Now, White et al. Reported the use of HIFU in aesthetics in 2008, after which it was approved only for brow lifting. Now, currently, the dermatologists are using it for facial rejuvenation, body contouring, and also some gynecs and dermats are using it for vaginal tightening. Our knowledge and understanding about HIFU is basically extrapolated from what the dermatologists have been doing it for so many years. So we do basically understand that most of these machines work with an concept that we will give heat in any area that will cause contraction of the collagen, and that will give the tightening, or we will give heat and that will cause rejuvenation. Now, whenever we are dealing with cosmetic gynecology, it's mostly about rejuvenation and restoration. So heat is very important part of that. In fact, I think you must have known dermatologists use the red light cap and all that for the same reason, that they want to rejuvenate and restore. So, in the similar way, HIFU is something that we use. Now, what is the principle of HIFU? Basically, when we throw in ultrasound, which is of a very high frequency, the sound waves go toward the object, and whatever is transmitted back, we see as imaging. Now, that is how we use sonography for our scans and imaging in general. Now, HIFU is something a little different. I'll just move a couple of slides. Now, when we are doing ultrasound, there is a point, and the radiations are divergent. But in HIFU, when we are using it for tightening and when we are wanting heat at a particular area, we use a concave probe, and that sort of diverts the entire energy to a particular point. Now, as you can see on this slide, this focal point is where we want the action. These convergent ultrasound waves will cause heat in that area. This heat will be a medically directed and a sort of guarded energy that we will be giving, and that will cause the entire effect of HIFU that we are going to be seeing. So this is the principle of HIFU in short. I am going to be talking a little bit about the principles and physics, but mostly I'm going to be dealing in the later part of the talk about how to actually use HIFU, and I think that will be very useful in your practice, because it's like a 101 on starting how to do your HIFU practice. Now, basically, HIFU causes cavitation and thermal coagulative micro damage, which is caused by a sudden rise in temperature of about 60 to 65 degrees Celsius. Now, when there is a concave ultrasound transducer that we saw, it converges the ultrasound to a particular depth. Now, the depth of that where it's going to converge is based on which probe we use. There are two probes that we use as gynecologists. One is the 3 probe and one is the 4.5 probe. When we are using the 3 probe, the depth of that penetration is up till the 3 mark, and 4.5 goes even deeper into the muscularis layer, which gives a tightening effect. Dermatologists also have another probe which is 1.5 ml, but we are not using that in cosmetic gynecology or in the vagina basically. Now, these convergent waves that we send start a molecular vibration of water molecules, which result in fractional heat, which rises the temperature of that place, causing the modifications. This is a regenerative and, mind you, controlled microburn. The word controlled is extremely important, because if it is not controlled, then it can lead to very, very dangerous and harmful effects, which we are wanting to avoid basically. HIFU produces micro lesions at precise depth. What we do is we cause small micro burns in different places, while we leave some healthy tissue in between. What this healthy tissue does is it helps in rejuvenation, it helps in neocollagenesis, and it helps the collagen fiber to organize. It helps the collagen to shrink and cause tightening. Vaginal mucosa remains unaffected because we are diverging the effect at 3.5 and 4.5, which is why the theoretical risk of burns in HIFU is almost negligible. Now, there is, and also as you can see in most of, when if you have gone for a laser hair reduction, or if you've heard from patients, when they use laser on skin for hair reduction, they use a cooling gel, and they have a vent wherein the air is spread on the skin, and then they do it. But because we are not acting on the skin directly, there's no need of cooling. The recovery is faster. There is no, and also it's non-ablative, which is why there is zero downtime. Meaning, if the patient does the procedure today morning, today night she can go swim, she can have intercourse. There is no need for her to stop doing her activities just because she's had this procedure. So basically, the Healthy tissue in the in between the microburns that we have caused causes neovascularization, neocollagenesis, and a complete remodeling of that tissue. We discussed this slide, so I'll move to the next. Now this is just a comparison. This is by no means to say that the other devices are not good, the other devices are not useful, but like I mentioned, each device has its role, and if you as cosmetic gynecologist can choose that well for your patient, you would give her an optimal result rather than either a dissatisfied patient or for a patient to come back with any complications. So if you are looking at a patient who has dryness or a little bit of vaginitis or discomfort in general, then laser and RF are devices that you should be. But if you're looking at a patient who has laxity, then you can definitely try HIFU in these patients because it works really well. Now we have two cartridges. There is a 3 cartridge, which I told you this goes up till the lamina propria and causes effect there, and the 4.5, which is the deepest penetration of all the devices that are available, which causes a depth of 4.5 which is a Claris layer, which is what we are aiming at. Now like I said, it is deepest, it is safe, and it is programmable, meaning that if we feel that we are dealing with a patient who is postmenopausal long time, we may altogether skip the 4.5 probe because we don't want any risk of any fistula or any other complications that we're doing. So it is upon us how we use, and as we use these machines, we get a little more comfortable and confident with the machine that we are using. The What are the positive effects that are seen in HIFU? The epithelium in the mucosa changes with better increased glycogen absorption in the superficial keratocytes, which explains the pH. So the pH becomes more acidic. So what they have done is they have done swabs of multiple patients where then they went did an HIFU and they saw that the pH became more acidic. Now when the pH becomes more acidic, we know that the vaginal infections are less, vaginitis is less, the microbe increases, and which is why the patient is much more comfortable down there. Now, this is related to its positive effect, which is seen in the GSM patients. The mucosal tissue recovery and restoration in terms of lubrication, elasticity, and compliance by neocollagenesis and angiogenesis is what restores anatomy and makes a patient feel confident and increases her self esteem about these issues. Now, let's talk about how to actually do the HIFU procedure. We are going to talk about steps that we do for somebody who has not started on HIFU. So, of course, when you buy a machine, you will get trained on it. But let's talk about what we actually do when we get a patient. First is, of course, counseling and history taking. I think this is absolutely the most important step when we select a patient. When we speak about her history, we ask about her menstrual history, we ask about how long she has been through menopause. So if she's a patient who's had a menopause many years back, we may hesitate to use HIFU because what, like I told you, HIFU is a robust technology. It's deeply penetrating, and we do not want to cause any fistulas for patients who are menopausal. So we would hesitate a little when we are dealing with postmenopausal women who are having extreme atropic vagina, who may have these kind of complications. We also need to know if they've had any procedures, any recent infections. We definitely ask for any cosmetic gynecology procedure, not just HIFU. We definitely ask for a history of herpes, and if she's had a history of herpes, we start a prophylactic anti-herpes treatment for these patients because invariably, of course, HIFU is not invasive, but invariably it will flare up a herpes infection, and the patient will come back to you panicking that she suddenly got this infection, and she might also blame it on the procedure. We also want to find out if the patient is diabetic because obviously increased sugar, we don't want to touch that patient. We find out whether there is pre-malignant condition or any malignancy. I, for one, to be on the safe side before doing any HIFU procedure, do a pap smear for the patient for a simple reason: we don't know what sort of an effect we're expecting. Plus, we always have a negative report before we start so that there's no doubt later on in the patient's mind as to why there is a change in her pap smear report or anything. Now, how will you decide whether this is a good patient for you to do HIFU on? First, discuss about the specific concerns. As gynecologists, we always examine the patient, do a per speculum and per vaginal examination. We always know what is the grade of SUI, what is the grade of laxity. We're always talking about how she's a little loose and all of that. But what your examination findings are there may not be her concerns. For example, you might see that there's a little bit of SUI, but that doesn't really bother her so much. So she will not discuss this, or she may not want to get that treated. So talk about what her concerns are, and your treatment, about how many sessions you'll be giving in, how what sort of a current you'll be giving in, is based on her concerns. So if she has concerns about SUI, we can treat it accordingly. If she's coming to you for laxity, you can treat it accordingly. And also, very important, at the start of therapy, set realistic goals. Now, when we start a cosmetic gynecologist practice, we are basically extremely enthusiastic, and we do promise a lot of things. But if we don't deliver, and if you've not set for realistic expectation, then she's going to come back, sore, and she's not going to be happy. It's very important that in this kind of a practice, we know that the patient is aware that she's going to get this much percent result. Don't over promise. If at all, under promise and deliver what you can deliver with this. Explain to this patient that HIFU is a relatively new modality, which is why there are not so many studies available in terms of leading for literature or even the safety. Explain this beforehand, because you don't want a patient coming back in and telling you that they could not find anything about HIFU, or they ask the gynecologist and they never heard of HIFU. So definitely speak about this. Tell them that there might be suboptimal results. Tell them about the complications. Basically, just go in around the entire procedure. Think about everything that she might go through when she goes back home, or what somebody might tell you. Also tell her about alternatives available. Now, whenever there is a patient who has a very loose vagina, do not offer these procedures. If she's a patient for surgery, she's a patient for surgery. She's definitely then not a procedure for you to do HIFU. So in your mind also, you should know which patients you're going to mobilize, because either these patients are extremely happy clients, or they are one bad review from what they experience. So that is a difference that you'll make by proper case selection for these patients. Now, consent. I think yesterday somebody shared a consent is very important. Write consent in the local language that you're dealing with. I had visited Dr. Manish Mahajan's clinic, and he showed me all the consents that he had written in Marathi and Hindi. So he done a very good job at explaining to the patient. I have a consent ready, wherein we discuss about all the risks, complications. We also take consents if we are taking photos or videos, and we also have consent when we are sharing the images. A lot of time patients don't agree, which is okay, but at least you are safe, and when the patient signs in, you know that you can share those images. So explain about all of this. Document if there is any pigmentation in genital area. Very, very important in cosmetic gynecologists. What we do miss as gynecologists is that if when we examine, if she has already had some boil there, or some procedure, or because of shaving there was some cut, document it, because you don't want her coming back and saying, oh, I didn't have any of this hyperpigmentation, and suddenly there is hyperpigmentation. If she doesn't give you consent to take photos, the easiest thing to do is take her photo, tell her that you need to take the picture, record the date, and tell her to have that photo with her. Tell her not to share it with you, but at least you will have that as a documentation, if at all you want to refer or cross check about any hyperpigmentation lesions or anything that she is mentioning. I mentioned about the pictures. Now, choosing the right parameters. This is how the HIFU screen typically looks. There are multiple parameters on the screen that you have to choose before starting to use. We will go through each and every parameter, so you know which one to use and when to use this. Okay. The first parameter on the screen will be the round. Now, this round means the degree that your probe will move on. There are two settings that you can do. One is the manual setting, wherein you can manually move the probe and give current at whatever distance you want. Though, according to me, it's a little cumbersome to use, but you can decide for yourself. If you're typically treating patients with SUI, you might want to go on the manual one and just give currents in the anterior part of the vagina. So usually I put it on the auto mode, wherein I just decide how many degrees. Now you can choose anywhere between 1 till 360. Mind you, never choose 360, because if you choose 360, you're going to give your shots at 12 o'clock position twice. So you should always choose something like 2 340 350 or something like that. Now this basically what I'm trying to say is that this round is a degree that your probe moves. So once you put it on an automatic probe, you put the probe inside and you just hold so that the probe moves at equal distance and covers the entire circle, whatever you want to do. Never shoot the same place twice, because that increases the chances of a fistula, which you do not want to get into. Now, what is the next parameter that we're talking about is the angle. This is a degree that the probe moves. So if this is a probe, it just keeps moving the number of degrees that you choose. Now, when you keep higher degree, it prevents thermal injury and a possibility of scarring. There were a lot of discussion about how HIFU can cause scarring because of the depth that it penetrates. Now, whenever you are keeping, we discussed in how the physics of HIFU, that when we are giving a particular point, we are giving that micro burn, we want the adjoining tissue to be extremely healthy, well nourished, and vascularization to be maintained, because we are expecting the nutrition and oxygen and all the growth factors to come from the adjoining area to this microburn to cause that remodeling. So if you're going to keep the angle very very near, you're going to deplete this area from the healthy vasculature that is there, and that would cause to either the effect to be extremely low, or in some cases it can lead to possible thermal injuries. So it is important that you keep the angle appropriate. Now the next parameter is the length. When you see, this is on the side of the screen, you can see that the probe of the hypo is pictured. Now, the black portion of this is the length of the transducer. This is basically the transducer that emits the ultrasound waves. We usually keep it entire at 25 or 2.5 centimeter. Basically, what this means is the entire length of the transducer will be emitting the energy, and then that energy will be conversion. Now, in generally, our vagina is around 7.5 to 8 centimeter long. So typically what we do is, whenever we are shooting, we shoot in three parts: the upper one third, middle one third, and the lower one third. So this 2.5 mark works best for us. So generally we keep it at the entire 2.5 length. The other thing is the pitch. Now when you shoot in a particular area, there are small areas where the target is being shot. Now that distance also is something that you need to take care of. Again, if the distance is too little, then we will not see any, we may see thermal injuries, but if distance is appropriate, then we will see good results in the patient. And last but not the least, the power. I think we typically do understand that the power is the energy generated at a particular focal point. Power is discussed in lasers, radio frequency, everything. One word of caution: when you use power, make sure that you start with a lower power setting. Don't directly jump at 2 joules, because that would mean that you are directly risking the patient if she has a complication. The other very important thing to remember is that when we use a HIFU current, we do not use any anesthetic medicine. The reason being that firstly, it's not painful, and if it is painful, the patient should be able to tell us that it is burning or it is hurting. Or a lot of time patients say, I'm just getting a sharp pricking sensation, and that's where you know that you need to reduce the power. So don't keep the power at the highest. What you can definitely do is, generally we offer 2 sessions of HIFU. Keep the power to a minimal or slightly above the minimum for the first session, and next time when you come back and you see her pain threshold is good and she's got result, you increase the power in the second session. Don't jump at it at the first one. Definitely when she says heat is, she's feeling heat, especially at the introitus. So like we know, the lower inner part of the vagina is not really sensitive to pain, but when you're at the introitus and the 4.5 they can definitely feel some kind of a pricking pain or heat, and that's when you know you need to reduce your power. Now let's talk about the actual procedure. This is how the probe of the HIFU looks. What we do is that we put in a jelly on the transducer as we would do in a normal sonography. We use a condom and cover it not to displace the jelly. We use the entire probe until the 7.5 centimeter mark, and generally when we introduce it, we almost touch the cervix. That's how we know that we are inside. I Like I said, that I usually use the auto mode, but basically you can use the manual mode, whatever you're comfortable with. Keep speaking to the patient. Luckily in cosmetic gynec, most of the times the patients are extremely healthy, happy, and nice. So you can keep having a word with them, chatting with them, asking about whether they feel pain or heat. The moment they feel pain, stop your machine and revise your settings and see what you can do better. Keep a steady hand. If you keep shaking your hand, then you might alter the angles that you've chosen, and you might under deliver the current, and then you might not see the results in her. Once the entire round, let's say you've chosen a 340 degree and you go entirely round, take the probe out by 2.5 centimeter and shoot the entire round again in the middle two third, repeating in the outer one third. Once you do that, you do not have to repeat this again. One shot is more than enough in the patient. Now I'll just try to see if this video plays. This is basically, yes, it is playing. So basically this just explains to us how the HIFU machine works. This is the probe and the transmission area. This is how it looks. This is the handle where we hold a handle. It's exactly like a sonography. This rotates 360 degrees, and while the current is being passed, we can see the light so that we know that it is shooting the current. There are two transducers. One is the 3.3 mm and the 4.5 ml for deeper, more aggressive current. It is non-invasive. No anesthesia is needed. uh, this is how it actually works inside the vagina. So we choose the upper one third, middle one third, and lower one third, and keep getting currents in each of the area to get absolute tightness and optimal results for this patients. There is a rise of 60 to 65 degree, and that's how the machine basically works for us. So this is just a comparison, but like I said, you can choose what you want to choose for each patient. So sorry.
Rachna, your slide sharing has stopped.
Stopped. Okay, just one second. Just a couple of slides left. So just
You just have to press that button which is down below the green one which says share.
yeah, I am doing that. I am finding it a little difficult. Just give me a minute. Just the last couple of slides, which I can just read if we can't see it. Just trying it for a minute and then.
Meanwhile, if there are any questions, I think Rachna can answer them also simultaneously, so that we can just save some time on that.
Yeah, sure.
Any questions anybody has regarding HIFU? So I think our speaker, Dr. Rachna, would be more than happy to answer it for all of you.
Ma'am, how would we know that it is rotated 360 or 340 degrees, whatever you said?
Actually,
How will
there
we
is
know? Is there some indication or something?
yes. So there is there is sort of a marking which you can see, and when it is moving, we can see that marker sort of go round. And when that is rotating the entire, so there is a scale, like I showed you, there is a scale. That entire scale keeps moving, and when it is back at 340, you can see that scale again. So that's how we know that it's moving. And even though the probe is inside, a part of it is outside, so we can actually see the rotation happen.
Doctor
How
Raj,
long does it take for one rotation, ma'am?
About 3 to 4 minutes in each rotation, and you have to do it. So entire procedure is done within 20 minutes.
And regarding the depth, how much depth you can go inside actually?
So actually, like I said, there are two probes. There is a 3 mm probe and the 4 mm probe. Now, when we are using the 3 mm probe, we know that it's just going into the lamina propria. So when we are dealing with minimal laxity, and we are also dealing with SUI, this is a very, very good probe for SUI. The 3 mm probe will converge at a 3 mm point. And the 4.5 will converge a little deeper. So when we are dealing with absolute laxity, then 4.5 works very well. Otherwise, 3 mm is the one for, especially for SUI.
For SUI, is there any point mark to tell we have to go till that depth? Is there
So
any marker?
there are actually no studies, but like I said, if the patient is a healthy woman who's just had her delivery, and then firstly, I would like to say that we don't treat patients until 1 year postpartum, meaning when she is breastfeeding and lactating, we don't do it purely for the reason that the hormones are not yet back to where they were. But once she is 1 year postpartum, we can start treating it. Now, healthy young patients, we definitely can use both the 4.5 and the 3 mm. But when we are talking about a postmenopausal woman and we feel that the sometimes the vagina is very very pale and fragile, and sometimes even when we do a speculum examination we know that she can have some bleeding. In those patients we restrict to up till 3 mm only. We do not go use the 4.5 mm one.
In the auto mode, what are the settings, madam?
So the ones that I discussed, basically auto or manual is the only difference. The entire presentation that I showed about the round, about the degree, the pitch, energy, all the things you can choose either in the auto mode or the manual mode. The only thing in manual mode is that the angle will not be changed by the machine. You will sort of have to hold it and change the angle yourself, but the energy and everything else can be decided. So the angle and the degree will not be changed by it. You will just have to do it yourself. That's the only difference.
I think, Rachna, people want to know the finances. I mean, what is the cost of a HIFU machine?
Okay, so there are no patented machines as of now. What from what I know, there are multiple options available now. The one which we bought is from a Korean machine, so everybody sells it at a different rate. There's no standardized machine that is available. It would cost anywhere between upwards of 4.5 to 5 lakhs. The good thing about the HIPU is that there is no consumables. Like you don't have to buy any separate this thing for the patient. You can use the entire probe. The cartridge is the only thing that you need to change, which can give up to 10,000 shots. So you can use it in multiple patients before you have to change the cartridge itself. So according to me, it's a pretty affordable technology, especially if you want to start small, see how your patients are responding. This is a good alternative for them.
I
Madam, you
think
use a probe
absolutely.
directly, or we apply some, we have to cover the probe with some condoms and use
Yes,
it like.
yes. We have to put the jelly, just same like sonography. Put some jelly on the probe, on the transducer, the black part of it, and cover with a condom and use it. Before the next patient, you can just clean it with a spirit and you can use it.
I think Sameer
Madam,
sir wants to know that if at all he has done a pelvic floor reconstruction, or if he has done a POP for a case of POP and he never wants a wall prolapse for that particular patient, can he give HIFU 3 months post-op, few sittings of HIFU to these patients?
Okay, so there is no research to say that if you have used tapes, especially, or if we have used any mesh, if we can use HIFU. There's no study. So I would say that if you have used a probe, please steer clear of any cosmetic gynec procedure. In fact, like I mentioned in the history, do not use it in these patients. But yes, if you want to use HIFU in these patients, what I do generally is use it before the procedure. So let's say you have a patient who is typically a case for surgical procedure, but you also want that the vagina is a little bit of rejuvenated. You should do HIFU first in these patients and then go ahead with the surgery, because that will also enhance the results of your surgery. So definitely HIFU, 2 months break, and then surgery is a better thing to do rather than surgery and HIFU.
I
And
think Sameer
regarding
sir has a very
SUI
interesting
patients, which
question.
patient to select, madam?
Sorry, I'm
In
sorry.
SUI, which SUI patients you can select for HIFU?
So anyone who has grade 2, grade 3 cystocele and having leaking are patients that you can select for this HIFU. What it basically does is it increases the tone. So anywhere where we are actually using the tapes, of course, I am by no means trying to say that the HIFU will replace any surgery or any tapes. But when we are seeing that she's just leaking sometimes, especially stress, urinary incontinence because of postpartum or because there is laxity, will respond to this.
Okay, I
efficacy
think
and
Sameer
safety
sir has a very
compared to
interesting
laser.
question here.
Yes,
Uh,
please.
Saying this that is any PCPNDT thing required? But I think Manish sir has answered it very well, because we cannot see any sex of the baby or nothing of that sort
Yeah,
has
so it
can be done
doesn't.
by HIFU per
Correct.
se. Otherwise, I think the quacks would have been buying these machines and doing all sorts of those things.
I think they would. Yeah, that yes. But I think the quacks are already buying this machine and you doing
Like
cosmetic
they're doing it for
gynecology.
the cosmetic and aesthetic part, not
They
for
are already,
deciding the
Arul, they
gender
are
and stuff like
already
that.
ahead of us. So we are never going to be able to catch up with them. So that's okay. But yeah, no, we don't require PCP NDT for this.
I
In
think
fact,
they
that's
always make more money than what we do.
absolutely.
So I think they always have the corpus to buy and invest in all these machines.
Agreed.
Any whichever
Ma'am,
way,
how
there is.
frequently do you do the HIFU sessions? Can we repeat?
Okay, so when I see the patient and then I do a proper patient selection and I think that this is a good patient for the HIFU, we do two sessions 2 months apart because it takes about let's say 1.5 month for the rejuvenation to happen. So doing it before that would not be very effective. So give us a gap of 2 months, and if she's responded well, we generally do the FSFI index also for patients, specifically if they're coming for sexual difficulties. Then we do the FSFI score also. I have seen in my patients the FSFI score improving in them. We do one, let's say today, one after 2 months, and then we call them back after a year. Once they start feeling a little loose again, or they start seeing these symptoms of SUI. So a lot of times patients do come back a little sooner, maybe 9 months or 10 months is the time that my patients have come back and said, no, now we want a sessions. Most of these patients are, if they see results, of course, then they do come back and realize that they've not gotten the now they're losing that effect, so they come back again. Usually that's somewhere between the 9 month to 1 year mark.
Rachna, somebody wants to know, is there any anatomical landmark to judge the thickness of the vaginal wall?
No, not that I'm aware of.
Dr. Mukta wants to
There is
know about.
there is one second. There are sonographies that we do. There's one sonologist right across my clinic, and she does a very good pelvic floor assessment with her sonography. So I think a sonologist will be able to do it. But I generally just go by the parameters of how the vagina actually looks when we are doing this procedure. So if we feel that the vagina is really thin, we steer clear of HIFU, at least a 4.5 probe.
How much is the complication rate?
Touch wood, I've not had any complication, but I'm going a little easy. Like I never give extremely high currents to these patients. So I generally start very small. And when I'm seeing, and when this patient has seen the result in the second time, I increase the current. So I have not seen currents, but yes, there are theoretical complications of fistula. So you have to be extremely careful when you are giving the current, especially in the anterior wall and exactly at 6 o'clock position. In the anterior wall, make sure you do not shoot at the same place twice. I think that would probably solve, I mean, that would make sure that you do not have any fistula in terms of because of the heat.
Like you said that you do it prior to